A number of areas of the brain are affected by MSA. This has led to different varieties of MSA receiving different names, depending on which area of the brain has predominant involvement. When MSA begins with imbalance, incoordination, and difficulty in speaking, dysarthria, it is often called olivopontocerebellar atrophy. As the name suggests, this form of MSA is marked by a degeneration in the cerebellum, a structure involved in balance and learned motor tasks.
I hope that my legs will get a bit better, a bit stronger, so that I can walk a bit easier. But it is helping, it is getting there. But my hands there's no shake, and she's able to play cards on.
The following patient suffers from this type of MSA, which is also called MSAC because the areas affected involve the cerebellum.
She takes 1 level teaspoon of this product in warm water with a touch of runny honey to make it more palatable.
Patients suffering from MSAC usually do not show any response to the standard Parkinsonian medication. This is precisely the case of the 4th patient represented in this video. She did not show any response to Sinemet. Moreover, she was affected by serious side effects which are not usually present in the first year in most of the patients using this drug. We would like to suggest that this patient, as many diagnosed today with MSA, might suffer from a high sensitivity to specific synthetic chemicals. This chemical sensitivity might be a confusing determinant when trying to diagnose the disease.
And using the equipment for washing and drying the clothes and the bedding and the linen. And I can also bath. I have a bath lift, and I can use that on my own and in and out of the bath, and which I couldn't do before. And I'm able to get out of the chair without any extra assistance.
Can you get into your easy chair without assistance from your husband?
No, I don't need any assistance at all. I can get in and out of the chair on my own.
So this seems to be an improvement then?
Yes.
Following on to the questions put to Mrs. Webster, here she is, standing at the sink of the kitchen, washing up the crockery and cutlery that we used at breakfast time. Now you will see that she's not using a stick or any other aid. She's relying on the actual sink area to keep upright. But there she is, washing the dishes and putting them onto the dryer, ready for drying and putting away. So there she's able to do some household duties.
This patient showed rapid improvement after using a purely organic dietary intervention. We can assume, therefore, that she suffers from a high sensitivity to non-organic chemicals. This suggestion is endorsed by another experience. When this patient started on a clinical trial for a new drug for MSA, she had to drop out at the very beginning of the study because of adverse reactions and innumerable side effects. Most of the other patients in the trial were not troubled by these side effects. The chemical sensitivity in this patient is higher than normal. For this particular type of patient, who cannot tolerate larger doses of drugs, we need to consider prescribing organic interventions with natural products that can help them in a similar way as with the drugs, but without adverse reactions that can sometimes confuse the diagnosis.